January is Thyroid Awareness Month, and Ashley Gillier sat down with endocrinologist Dr. James Hennessey to find out about the gland and what people should know to make sure it's functioning properly.
The thyroid gland is located in the neck just above the collarbone and produces important hormones. Fortunately, almost all thyroid diseases are reversible if they are found in time.
Hypothyroidism is by far the more common thyroid dysfunction, and it occurs for numerous reasons, but the most frequent reason is that the thyroid gland itself is destroyed through one of many different kinds of processes. The underfunctioning patient might feel tired, cold, constipated, might feel bloated, might feel puffy because they retain water, might actually feel as if they're sleepy all the time or that they can't concentrate, because thyroid hormone is essential in maintaining all of those actions. We simply replace thyroid hormone, which can be taken orally once a day, and is a very satisfactory treatment for the vast majority of patients.
Another condition to be aware of is hyperthyroidism.
Hyperthyroidism, on the other hand, doesn't occur all that frequently, but when it does, it typically has some substantial impact on the patient's health. They'll frequently be anxious, overreactive, emotionally tense. They might feel warm all the time. Their heartbeat might be very fast. The hyperthyroid people in the long run might wind up with bone loss and perhaps an increased fracture risk because of osteoporosis, or may wind up with cardiac problems like atrial fibrillation, or if they already have heart problems, heart attacks.
Thyroid nodules are lumps found on the thyroid.
Thyroid nodules, 9 times out of 10, are benign. They really have no consequence. 1 time out of 10, they might be a thyroid cancer. Now, thyroid cancers, 9 times out of 10, are nothing to really worry about, but a small proportion of thyroid cancers are very aggressive.
Eating a well-balanced diet with iodine-rich foods such as dairy products and seafood can help maintain thyroid health.
But one thing that's very important is that young women of reproductive age frequently are found to have the lowest iodines in the United States. And so here we have the highest risk group, meaning we want to make sure that women of reproductive age are receiving enough iodine so that both the mother and the baby have adequate amounts of iodine to generate thyroid hormone for their metabolic needs. And that's just exactly the group where nearly 25% of young women between 19 and 25 are the lowest group in iodine intake. So when it comes to that, the first thing I would say would be, young ladies, start taking a multivitamin or make sure you have some iodine in your diet. Don't avoid it. Secondly, if you are getting ready for pregnancy, take a multivitamin or a prenatal vitamin that has specifically iodine in it. And we'd like to see 150 to 200 micrograms of iodine total per day in a pregnant woman. So read the label, and if it's got 150 micrograms of iodine in it and you drink some milk or eat some cheese or whatever, then you probably are getting an adequate amount of iodine.
For the Needham Channel News, I'm Ashley Gillier.